We're all here to help you understand the process, to teach you, and because I know many of you are just starting your research, so there's a lot of information. So what I'm going to do is tell you a little bit about our program, and then I'm going to walk you through the process of what we would do if you became a new patient of ours. So in our brochure, and they're at our table downstairs if you haven't received one, we say, we help create some of the world's first IVF babies. Our babies are now 30 and having babies of their own. We literally are one of the the United States' first IVF programs, founded by my partner, Richard Mars, who started the practice 10 years before I joined. And so we've always been a center, internationally known center for in vitro fertilization. And we're committed to providing our patients the highest quality care possible today. And I mentioned in my introduction this morning that about 4 years ago we built a new IVF lab from the ground up because technology keeps changing. This is a rapidly advancing field of reproductive medicine, and you have to keep up. In our new IVF laboratory, we have a highly purified air system, state-of-the-art incubators. We have a new continuous culture system, and I'll talk about that more in a few minutes. But you want to make sure you're working with a program that really has kept up and is providing you the highest quality medical care inside the laboratory. Personally, I've been with my practice for 30 years, and I love what I do because I get to make babies and I get to help you become dads. And I'm a gay man, and so I'm very committed to helping gay men have children if that's part of their dream. You know, when I was in my 20s and 30s, you know, none of this was possible. So my partner and I were both in our early 60s, and when we were the age of many of you, our colleagues, our friends were fighting AIDS. So having children was really not in our focus. So it's so exciting for all of you that you can now get married, you can become dads, and you can have the life that you dream of. So what's the first step in this process? Well, I always ask guys at this event if they've ever had a semen analysis, because most men haven't until you begin this process. So if you haven't, I highly encourage you to ask your doctor to do a semen analysis. You want to get an idea of the quantity and quality of the sperm, because if your sperm is a little low, it's not moving so great, we can treat with vitamins, antioxidants to try to optimize the sperm before you come to LA to freeze your sperm. So, and I put together these cards, they're at the table downstairs, I'm a little low on them here, the 5 steps to start your family. Step number 1 is to come to Los Angeles and freeze sperm. For most of my patients, I'm going to use frozen sperm to disseminate the eggs on the day of the egg retrieval. The only men that I ask to come give fresh sperm are men with very low sperm numbers, because whenever you freeze and thaw, you are going to lose some sperm. So if your numbers are really low to start, you don't want to risk not having enough sperm. But for most men, you'll freeze sperm, we'll do all the required infectious disease screening, genetic carrier screening, and your sperm is set in Los Angeles. Step number 2 is to select your egg donor. And this, I think, is one of the most, if not the most important steps, because not only do her genes provide the genes of your children, but her egg quality has a large impact on embryo quality and ultimate success rates. So of course you have to like the person, and I work with a dozen or more outside agencies so you can find the right donor for you. And you can really find whatever you're looking for in terms of ethnicity, educational background, personal interest. So you really have to find the one that you're really excited about. Next, she has to pass her medical scrutiny. My goal in this process is for her to make 20 to 30 eggs. And if she's a first-time donor, there's a blood test we can do called AMH, anti-Mullerian hormone, that will predict how many eggs she'll make in the process. If she makes 6 eggs, you're going to compromise herself. So we want minimum of 15, but ideally 20 to 30. The egg donor completes her medical screening. She has psychological screening, infectious disease screening, urine drug screening, an ultrasound, a blood test, like AMH to predict ovarian response. Once she's medically cleared, we're ready to go to step number 3, is to create embryos for freezing. 5 to 10 years ago, we didn't create embryos until we had our surrogate ready. But today, in high-quality IVF labs, pregnancy rates with frozen embryos are the same as fresh. So today, we elect to freeze all embryos in advance and transfer at a later point. The other advantage of freezing is it allows us to do genetic testing of the embryos. So the day of egg retrieval, we're going to thaw your sperm and inseminate the eggs through a process where we take one sperm, inject it into each egg. That will provide a fertilization rate of about 80%. The next day is day 1 of culture. We have a fertilized egg or one-cell embryo. Next, we keep the embryos undisturbed in culture until day 5. Between day 1 and day 5 to day 6, we expect about 60, maybe 70% of those one-cell embryos to grow into a 100-cell embryo called a blastocyst. Some never become blastocysts because they're abnormal. Once they become a blastocyst, we can biopsy them and freeze them. When we biopsy them, we remove 3 to 5 cells from the outer layer of our 100-cell embryo, freeze the embryo, and test those cells to see whether or not that embryo contains the correct number of chromosomes. And what we find in a 20-something-year-old egg donor population, about 30 to 40% of those embryos will be abnormal. They can look beautiful, but have Down syndrome or any trisomies of basically any other chromosome. So by genetically testing the embryos allows us to select chromosomally normal embryos for the embryo transfer, which will increase pregnancy rates and lower miscarriage rates. And if you have a highly responsive donor, I've had donors where we had 18 blastocysts, how do we select the best one for transfer? This guides us in that selection. It also will tell you the gender. So if you do have a gender preference, we will have that information. If we have 2 sperm providers, we can divide the eggs in 2 equal groups, inseminate half the eggs with each of your sperm, and at the end you'll know how many normal embryos you have each. And the goal of this process is to generate a sufficient number of embryos to give you multiple attempts at a pregnancy, because the medical expense is involved in generating the embryos. So you want to make sure you get pregnant from this treatment cycle, right? And maybe you'll have multiple babies, but so we really want to optimize egg number, egg quality, embryo quality. Embryo quality is impacted by the egg donor, your sperm, and the IVF laboratory. So my job is to help make sure that each component here, the eggs, the sperm, the embryo, the uterus, are as good as they can be. And that's how we give you the highest chance of pregnancy. So step number 4 is to select your surrogate. Am I okay on time? So surrogates are these amazing women who come from across the United States who give up a year of their lives to help you become parents like they are. And that's why they do it. They're doing it from the heart. You know, they're paid anywhere between $30,000 to $50,000 for a year of their lives and for putting their lives at risk. When I screen new surrogates, I always tell them, you know, pregnancy is a health risk for women. There's major complications that can occur during pregnancy. And they agree, but they've had very normal pregnancies. Basic requirement for a surrogate is she's had at least 1 normal pregnancy with delivery at term, ideally not more than 5 vaginal deliveries, not more than 3 C-sections. So you will select your surrogacy agency. They'll show you several profiles of surrogates. And so you're really going to look for someone whose history you like, whose story you like, someone that you can relate to, and ultimately you're going to trust with your baby. Once that match is made, the agency will send her to me to complete her medical screening. I'm going to review all of her prior pregnancy records to make sure there's nothing about her that would make her a high-risk pregnancy in any way. Because again, I want to provide you this optimal carrier for getting pregnant and for carrying the pregnancy to term. So now she's passed all of her medical screening. The next step are the contracts. Your lawyers will make the contracts. Contracts are very important because they really define you or you and your partner as the legal parents of that baby. So when the surrogate goes into labor, has the baby, the contract really defines you as the parent and not the surrogate. In the United States, surrogacy law is state law. So there are some states where surrogacy is illegal. California has always been one of the safest places because the laws are very protective of your rights as the intended parents. So now we have a signed contract and we're ready to plan the transfer. Now the surrogate can live anywhere in the United States. Her treatment is relatively simple. She's given hormones in amounts that mimic the hormonal changes of a natural cycle. And in the natural cycle, there's about a 1 to 2 day interval when the uterus is receptive to embryo attachment and implantation. So we're going to mimic that with hormones, and on the appropriate day, we're going to thaw and transfer 1 or 2 embryos. And so you'll tell me which gender you would like to transfer, and we're going to transfer the embryo of the highest grade of that gender. You can, if you happen to be in Los Angeles, you can be in the room at the time of the transfer. Very cool. You'll get to see your embryo up on the video monitor, and it's nice to be there to support her. 10 days later, we get a positive pregnancy test, and then she's continued on her hormones until the placenta takes over. Eventually, the placenta is going to make hormones, and the pregnancy is really going to support itself. Patients often ask, can I transfer 2 embryos? We really want twins. That's a decision you'll make between you and your surrogate and your agency and your clinic. More and more agencies and clinics are going towards single embryo transfers just to minimize the complications of a twin pregnancy. I'd say in our program, about 85% of our transfers are single embryo transfers. But I still have patients that say, you know, this is a huge process. We only want to do this once. We ideally want 2 babies, and so we'll do a double embryo transfer. More and more, though, I'm having patients who say they want 2 babies at the same time, but they really don't want to take on those medical costs or the potential medical expense of a pregnancy with a preterm delivery, so they'll use 2 surrogates, put 1 embryo into each of 2 surrogates. So the costs are a little bit higher, but you can avoid those complications of a twin pregnancy. Questions? That's my crash course on how to make a baby. So.
Si vous avez des questions en français o si avez des questions en italiano o en español, puedo ayudar a traducirlas. Je peux vous aider a traduire.
Now for the egg donor also, she can live anywhere in the United States because her treatment takes about 2 weeks. The first half of her treatment, she can live in Kansas or New York, and she's monitored at an IVF clinic. They email me the data. The second half of her treatment is where all my important decisions are made, and I need to see her in Los Angeles. So she'll fly to LA, she'll stay in a hotel for a few days, so it'll add a couple $100, but considering the overall cost, it's really not all that significant. And that's why when you're looking at egg donors, she doesn't need to live in LA. She can really live wherever, because you really want to find the perfect egg donor for you. And that's why I work with outside egg donor agencies just to give you this wide choice of egg donor candidates. When you're looking at egg donors, it's a little like online dating. You're going to look at her photograph, read her story, read her family history, and we're such a diverse state, diverse country, that you can really find whatever you're looking for. What have I left out, Juan?
I think you covered pretty much everything. I think that, I don't know if you prefer in French, and yeah?
Yeah.
English.
What if the first treatment, the IVF treatment, doesn't work?
Okay. If the first transfer doesn't work, the next month we're going to go right into a second transfer. And again, that's why we want to make sure in our egg donor treatment cycle we've generated a sufficient number of embryos to give us multiple attempts at a pregnancy. Most patients get pregnant on the first embryo transfer because the pregnancy rates or 70% with a single embryo transfer. So most of the time, you're going to get pregnant from that transfer. You know, over 95% of the time, you're going to get pregnant from that first egg donor treatment cycle. But again, you want to select your egg donor very carefully. When you're looking at egg donors, there will be first-time donors and repeat donors. If she's a repeat donor, the agency can tell you how many eggs she made in a prior cycle, how many embryos were created, was there pregnancy from that cycle. So it's always a little less risky to use a repeat proven donor with a good track record. If she's a first-time donor, we're going to check an AMH level just to make sure that she's going to make a sufficient number of eggs for that treatment cycle. So a high AMH level means high number of eggs. Low AMH level, we're going to pass, okay? Because we want to make sure we have enough eggs, enough embryos for that, from that treatment cycle.
Just
What-
one last thing I would like to add to your discourse. As a parent myself with surrogacy, I think that the most important when you're starting in this journey is that you choose the right doctor, the right agency. It's a long process, it's expensive, it's complex. So I encourage you to sit down and speak directly with your doctor, with your agency. If it's not physically here in Brussels, it can be done over Skype. But it's super important that you feel comfortable and you feel the connection with somebody who's going to be, at the end of the day, your partner in this journey to build your family.
And if you'd like to get started, the next step would be just to call or email and schedule a consultation. I'll briefly review the process, and then you're officially a patient of the practice. It can be by phone or Skype, or fly to LA and visit. Come in person. Thank you.
Thank you.